Hey guys, today I wanted to talk with you about transitioning your baby from the breast to the bottle. I know that it can be difficult sometimes to get your baby to take a bottle, and I wish I had a really quick tip that would work for everybody, but honestly, it just takes trial, error, and a lot of patience. But I'm hoping that my tip may be able to help speed that process up a little bit and give you that little bit of, you know, insight that may get you around, that may make it click for the baby. Um, the first thing though that I want to mention is when you have a breastfed baby, it's really, really important that you use a slower flow nipple. Okay? This is important because in order for a baby to get milk out of the breast, they have to suck some before a rapid flow flows. So before you cut down, they have to suck. Um, Usually for anywhere between a couple seconds to, a minute, a couple minutes, honestly, if you have a slow letdown. But that there is no instantaneous bolus of liquid that they can then swallow. So when you introduce a bottle and the bottle flow is a little bit more rapid, you may find that the baby prefers the path of least resistance, and that's just common among people in general. Um, if you have to work less hard to get more results, you're gonna take that route. Um, so choosing a bottle that has a slow flow, especially when you're establishing breastfeeding, is so important. Now, what does slow flow mean exactly? I would like to say that there was a specific rate at which slow flows flow at, but I just wanted to show you. This is a Dr. Brown's bottle that I use. This is a 1, so it's made for newborns. And I really like this bottle specifically because of the fact that my daughter traps a lot of gas, and this reduces that. By the mechanisms that are involved with the bottle. This is the setup that we were using when my daughter was in the NICU. Okay, she was born prematurely, and so we started bottle feeding while she still had her tube in before we even established breastfeeding. And luckily, she took the bottle. She was okay at the bottle. She preferred the breast, and I could tell that. Um, so I was super excited when we came home and she was breastfeeding. The problem is that she needs to take iron, and the only way to give her that iron is via bottle, and at least for us. And we started having some difficulties getting her to take the bottle, and so um, that's how I found out this little tip. So this is the setup that we were using, and they both are considered slow flow nipples, okay? Um, but I wanted to show you the difference in that this bottle drips at that rate, and this bottle drips at that rate. I'm not sure if you can see it very well, but there, okay? That's the difference, okay? Now, why is this important beyond in addition to what I mentioned about the baby having to work for it and may develop preference, um, understanding slow flow nipples or understanding the flow of a nipple and will help prevent overfeeding too, which we may get to at a different video. But understanding that the bottle drips regardless of the work that the baby's doing is really, really important to know when you're thinking about bottle feeding versus breastfeeding. Okay? So what I normally recommend all the time for anybody, whether you're formula feeding or you're breast milk feeding, is to sit your baby in a more upright position. Okay, the traditional baby laying on the back is not typical for even breastfed babies, which tend to sometimes be at more of a reclining position than you would expect from bottle feeding, especially with the fact that the bottle drips consistently. So if you have a baby who's laying down to where your bottle is completely upright, you're going to have constant flow. Every time the flow drips into the back of the mouth, the baby's going to swallow, which is how you get overfeeding. Or choking a lot of times. If you have a lot of choking, you may want to sit the baby up. So I always recommend new moms or any mom. I always recommend mothers. Um, I always recommend mothers to sit their babies upright or more upright. I sit her straight up onto my knee. We originally were starting kind of in a more sideline position when she was learning how to feed, but now that she's pretty skilled, we just sit upright. Um, and it allows me to monitor how much milk is in the nipple and allows me to get the breastfeeding off, the bottle feeding off to a good start. I never immediately just shove the bottle into my baby's mouth. What I usually do is if um, I kind of start before she's really starving. That's another thing that I think about too. When you have a baby who is, has preference to one thing or is trying a new task, I always recommend starting before the baby is hungry. Okay, so if you're trying to get off the nipple shield or you're trying to introduce the breast or you're trying to introduce a bottle, do it before the baby's actually showing, hunger cues. Sometimes you can get away with, pretty early hunger cue signs, but if you are wanting to try, do it before you feed, before hunger cues are started. Um, my baby doesn't show, Ariana doesn't show hunger cues. She goes from 0 to crying really, really fast. And let me take it back. Many times she doesn't show hunger cues. She just goes straight to crying. She's 3 months old now, and I'm noticing a little bit more. She's starting to be a little bit more interactive, or a little bit more forewarning. But I don't know if it was just because my daughter was premature, or I know part of it's because she's premature, but I know other babies who have been born at full term that also go straight from being, oh, I'm kind of hungry, I don't want to let my mommy know, to, oh my goodness, I am starving, give it to me now. And I think that just has to do with temperament. But so introduce whatever new task that you want them to learn before they are frantically hungry. Um, I don't do time feedings, I feed on demand, but I've gotten to know when she is receptive to taking the breast or the bottle, and so I kind of just try to time it around there. And if she's not interested, I don't force it. And if she is interested in trying but doesn't like it, I again don't force it. Very, very important to not force your baby to do something that it doesn't want to do. Um, Signs to look for that they're not ready or they're not liking it or they need to stop is that they may, tense up their body or do a lot of facial movements. Like they may continue to suck, but they're, not happy about it at all. Um, Pushing the nipple, especially when you're trying the bottle, pushing the nipple out of their mouth or spilling milk out of their sides are clear signs that they need a break. They may need a break for a couple minutes. They may need to stop for the whole day, but they do need a break. Okay, so for me, I'm taking my baby who is not starving, and I usually try to elicit, the rooting. Sometimes she's, opens up her mouth just because she knows that that's what to do now. But originally, when starting out, I would, stroke the lip, stroke the sides of her mouth so that she would root and kind of open up her mouth. And sometimes at the very beginning, I would kind of, I don't want to say force it in because that's not the right word. You should never really force it, but she'd be receptive, but she wouldn't suck the nipple into her mouth. Usually when you think about a baby that you're enticing, they are going to open up their mouth. You put the nipple kind of in, and they draw the nipple back, whether it's in the bottle or the mouth. She didn't do that, so I kind of like push it in a little bit. If she spit it out, I would take it out. Usually after a couple times of that, she'd be more receptive to it. Patience and trial and error is really what are the key points here. But so I take the bottle and I point it towards the roof of the mouth. The reason why I do this, I point it towards the roof of the mouth. The reason why I do this is because a baby's reflex to suck is when something touches the top of the mouth. when you are, which is another reason why sitting a baby upright is important because it's easier to control that. When a baby's laying down, you don't get that sensation to the roof of their mouth, okay? So you want to point it towards the roof of the mouth, and your child, he or she may suck a little bit and then spit it out. This is them getting used to whatever it is, a new texture or sensation, whatnot. Um, but with having a slow flow nipple too, even if they are just resting with the nipple in their mouth, trying to get used to it, there is not a rapid flow that's causing them to choke or having to swallow. Okay? That's what usually works for me. I'm a little bit more talented than my husband. He, I think he and she fight a little bit more when trying to get her to take her iron. I usually probably still have about 10 to 15 seconds of fighting on a good day, and maybe even a couple minutes um, trying to get her to take it. So even though she takes it fine once it started, I still have to battle with her about it, which is super shocking because when she first started taking the bottle, you know, she was really good at it. And then she took my breast and she was really great at that. And so when we got home, she was taking both and I was super excited. And I honestly was like way happy when she stopped taking the bottle. But then I realized that I still had to give her iron and it was just a mess. So that's that. If your child if you need to leave your baby with somebody and they're not taking a bottle, you do have alternatives. And this is important to know because if you have cracked bleeding nipples or you're needing to take a break from breastfeeding for a day or so, you want to really set yourself up for success by offering methods that won't make it more difficult to transition back and forth. And that's what I'm hoping to show you today. So the first thing I wanted to show you is a syringe. So you could do syringe feeding. Usually this is seen in the very early days when the baby is still either taking colostrum or low volumes of milk. You could do it for larger volumes. It would just take a really long time. Really all these feeding methods do, honestly, but um, the benefit of having the syringe versus the other methods is that you can really get the bolus of milk into the back of their mouth. So, as I kind of briefly talked about with the bottles, when milk pools in the back of their mouth, their reaction, their response is a swallow. On a bottle, and this is why bottles and breastfeeding is different, is when they swallow, that pressure removes more milk from the nipple when you're bottle feeding. At the breast, that doesn't happen. And with these alternative methods, that doesn't happen either. So you are reducing the likelihood that you're overfeeding your baby or going to overwhelm your baby. And you're also using muscles and different motions so that you are still preserving what is essential and necessary to the breastfeeding relationship. So this is my husband's orthodontic, I guess, syringe. He just recently had his wisdom teeth out, and so I'm not going to remove it from the bag since he's still currently using this. But as you can see, it has a long tail tongue, I don't know what you call that, a long nose to be able to sneak in the syringe while your baby's sucking on your finger or on a pacifier. Usually I would recommend a finger just because you can feel where the milk's at and whatnot and what's going on in your baby's mouth, especially if your baby has a disorganized suck. But so what you would do is you would draw up the milk and you would introduce it usually after the baby is already sucking on something like your finger, and you would squirt a little. I say squirt, not forcefully, but you would apply pressure so that milk would flow into their mouth and they would take a suck, and you would continue doing that, making sure to go slowly and not overwhelm your baby. Okay, it's very time consuming, but it works really, really well in the early days when your baby is only taking small volumes, because their tummies are small and they don't need a lot, and you're not having to spend an extended amount of time doing that. Um, the next option is spoon feeding. Okay, so here's a typical spoon works. You would have milk on the spoon and kind of tip it towards the edge. And with this method, babies tend usually lap out the milk. So you would put a little bit towards where their tongue is at so that they can kind of taste it, and they would lap it out with their tongue. Um, this works a little bit faster with higher volumes, especially if you have an older baby. They're pretty efficient, so you're just scooping. But I would say that this is kind of like a mid-range. You have a baby who takes more volume than small volumes and is a little bit more coordinated, but isn't drinking like, 3 to 4 ounces in a sitting. You can, a little bit more time consuming. And then the last option is cup feeding. Um, well, the last option we're going to talk about today is cup feeding. Um, if you have a medicine cup, you could clean it out, and that would actually be, I think, a little bit easier than a shot glass just because of the thickness of it. But the size and shape of the shot glass is similar to the medicine cup. And this is similar to the spoon. You would take the milk and you would put it towards the rim. You don't want to pour it into the baby's mouth, and they would lap up the milk. Um, the biggest hurdles with these alternative feeding methods is, I think, honestly, they're scary. Um, I know that they're safe, but I could see how a new mom hearing about alternate feeding methods are like, why am I going to feed my baby out of a cup? Especially when they barely can not choke on their own saliva. But these options really, really are good for a breastfeeding mom that's trying to preserve breastfeeding, but needs to feed an alternative method for whatever reason. Um, so I hope this was helpful and not confusing. I have a tendency to ramble, and so I hope that my goals of providing you with tips and tricks and alternative feeding methods helped you. If you have any questions, feel free to leave me a comment or send me a message if this is on Facebook. Um, feel free to leave me a comment. I'd love to answer any questions you may have. And yeah, yeah. Hi.